Kathleen with Senator Clinton's campaign. Thank you for joining this morning's call. We are joined today by Kathleen Brown, the campaign's domestic policy director, Fran Visco, the president of the National Breast Cancer Coalition and former resident of Philadelphia, Pennsylvania, as well as Pat Halpin Murphy, who is the president and founder of the Pennsylvania Breast Cancer Coalition. Congresswoman Donna Christensen has been delayed in joining the call, but should be joining us in just a couple of minutes. If everybody could please their phones if they're not speaking, I'd like to now turn it over to Kathleen Brown, our domestic policy director. Thank you.
Hi, everyone, and thanks very much for taking the time this morning to hear more about Hillary's plan for breast cancer. As you may know, Hillary is going to be on the Ellen DeGeneres show today, where she is unveiling her plan to find a cure for breast cancer in our lifetime. By setting a big goal in this area, Hillary is going to provide the national leadership on breast cancer and really leverage additional action around the country and make it clear that fighting this disease will be a top priority when she was president. The evidence shows that most young women don't actually believe a cure is possible, and Hillary wants to shatter this myth, and she's prepared to make the significant investments in research it will take to get us to that goal. Her plan is going to provide $300 million a year in increased funding for breast cancer research at NIH, the National Cancer Institute, and the Department of Defense congressionally directed medical research programs. She'll also establish a best practices institute, which will determine what the most effective treatments are for breast cancer and a host of other diseases. And we know there are tremendously impactful projects going on at NIH and the National Cancer Institute right now, and Hillary's plan will really build on those efforts. She's also going to make a particular targeted effort in the area of environmental research by enacting the Breast Cancer and Environmental Research Act, which will look at the links between environmental toxins and breast cancer and try to determine whether there are ways we can head off breast cancer before women get it. She'll also launch a special project to research the genetic and hereditary causes of breast cancer. She will continue the breast cancer research stamp, which Hillary unveiled when she was First Lady, and has provided $55 million since 1998 towards breast cancer research. In addition to research, Hillary's plan includes a number of areas in a number of efforts in the area of treatment, and of course the most significant of those is to guarantee access to affordable quality health care for all, which she's done through her American Health Choices plan. She'll also eliminate Medicare copays for mammograms, guarantee breast and cervical cancer treatment to low-income women by expanding the Medicaid breast and cervical cancer treatment program. And finally, she will provide targeted strategies to address the needs of disproportionately affected populations through a new racial disparities research project and by creating a young women's breast cancer research and outreach unit. So the whole plan, again, costs $300 million, and the cost has been laid out in Senator Clinton's plans to increase innovation by doubling NIH and the basic research budgets through major federal agencies, as well as her plan to achieve universal health care. So I'm happy to turn it over now to Kathleen.
Now we're going to hear from Fran Visco. Fran, are you there?
I am here. I'm Fran Visco. I'm a 20-year breast cancer survivor, and I am a resident now of Philadelphia, Pennsylvania, lifelong resident of Philadelphia. My office of my organization is in Washington, D.C., and I've worked as a survivor and an activist with Senator Clinton since October of 1992 when I first met her. To talk to her about the issue of breast cancer and to get her involved. And since that day, she has been an incredible leader and proponent for really substantive policies that impact breast cancer. We worked with her when she was First Lady to expand awareness and coverage of mammograms. We worked with her to establish the National Action Plan on Breast Cancer. The CDC Breast and Cervical Cancer Treatment Act was something that she was very much involved in helping get enacted, and also expanding support for important and innovative research, particularly through the defense budget. She has always struck us activists as someone who understands the policy approaches to breast cancer and to health. And also at the same time, she has incredible compassion and recognizes the human aspects of the disease. I've seen that time and time again. As senator, she is one of the lead sponsors of the Breast Cancer and Environmental Research Act. She has worked with us to increase funding, again, through the DoD program and at NIH, and she has been there for us every time we needed her to be. So she has, for many years, been a leader on this issue, and I say leader because, while there are many policymakers who pin on a pink ribbon and say the right words and who sign on to legislation, she truly has done much more than that and really has made a substantive impact. So we were thrilled to see that she has a comprehensive plan to address this issue. And I think one of the things I want to say about her is she also recognizes that, there's a great deal, she cares very much about this disease, but also there's so much political will behind ending breast cancer, and we have a very well-trained and established network of activists across the country who are focused on public policy and expanding care in this arena. And through our work and through our successes working with her in the White House and in the Senate, we've created models that have been replicated by other diseases. And so the impact of this work goes well beyond breast cancer. We're thrilled about especially the environmental legislation because we really do need to create a model for a strategic approach looking at issues of the links between the environment and disease rather than continuing to do it on a sort of community by community or, idea of what it could be by idea of what it could be and really take a strategic overall approach to it, which is the way she has approached all of the issues that we work with her on in breast cancer. So we're very excited about the plan. We're very excited about her continued leadership in this arena.
Thanks, Fran. Now we'd like to hear from Pat Halpin Murphy.
Hello, I'm Pat Halpin Murphy, president and founder of the Pennsylvania Breast Cancer Coalition, and I'm a 19-year survivor. I live in the Philadelphia area in Montgomery County, and our Pennsylvania Breast Cancer Coalition offices are in central Pennsylvania and Ephrata in Lancaster County. And I first worked with Hillary Clinton when she was in the White House as First Lady, and there was a nationwide campaign to gather signatures urging additional funding for breast cancer research. And we were able to gather, I believe it was 154,000 signatures in Pennsylvania, and we took them to the White House. And it was a very strong statement, and I salute Fran Visco and the National Breast Cancer Coalition for organizing that effort. And Pennsylvania was in the forefront of it, and it really sent a message, I think, to all in Washington that these were serious people and this was a serious issue and required a serious response from Congress. And certainly from Hillary Clinton, we got an advocate, a leader, someone who would champion this cause and do the hard work that was necessary to take good sentiments and make them into good law. And she, in fact, was a leader in doing that. And it was at that period that there was a large increase from the National Cancer Institute and those particularly from the Department of Defense on breast cancer, for breast cancer research. That effort has begun to taper off, and over the last few years, at least with the National Cancer Institute, funding has either held constant or has actually decreased. And we salute Hillary Rodham Clinton for this really big plan. It's a comprehensive plan. It's one that looks at all the different aspects of the breast cancer issue. It has the big overarching issue of research to find a cure, because that is our goal. That is what we want to do. That is what we're working to do. That's what we will do. And in order to make that happen, we need increased funding for research. And, of course, Hillary understands that, and that's the top issue that she is pushing for in her plan for breast cancer. Additionally, while that research is going on, to find a cure, we need to take care of the women who are being diagnosed now and are suffering through treatment. I'm a 19-year survivor because I had insurance, I had good insurance, and I was able to get the treatment that I needed to survive. Many women who are diagnosed with breast cancer are uninsured or underinsured. And Hillary, through her plan, wants to expand the breast and cervical cancer treatment program for low-income women who are uninsured. Those who are on Medicare are covered. Those who are in Medicaid are covered. Those who have good employers have insurance. But many, many working women work full-time jobs, some more than full-time jobs, but they do not have employers who have the decency to help them with health insurance. And so when they're diagnosed with breast cancer, it's not only a medical disaster, it's a financial disaster. Breast cancer treatment is very expensive. And how can they, from their limited budgets, even begin to think about paying for treatment? Some who have homes that they can mortgage homes and then lose them. Some go home and don't get treatment. We need an expansion of the breast and cervical cancer treatment program, and Hillary's program provides for that. And we would like to expand that and make sure that hospitals, in fact, do provide the treatment through this program. Additionally, many women on Medicare, although mammograms are covered through Medicare, don't have that extra $10, $20, $30 to pay as a copay. And to some who are working, an extra $30 might not seem a lot. But to a person on Medicare, on a fixed income who's struggling to survive, it may mean the difference between getting a mammogram and having the prescription she needs for a heart condition, or having enough money to meet that month's rent. So again, we salute Hillary. This shows a real sensitivity for women who are in Medicare and do not have an extra $30 to get that mammogram. And we do believe that this will save lives. Pennsylvania has been very severely affected by this disease. Pennsylvania ranks third in mortality in this country, well above our ranking in population as a state. There are many reasons for that, but it is a state that is particularly hard hit by this disease. And Hillary has provided true leadership, the only one that I'm aware of who has provided any kind of leadership on this issue that is key for literally hundreds of thousands of families in our state.
Okay, thank you very much. Has Congresswoman Christensen joined the call?
Yes, I have.
Hi, Congresswoman.
I came in during the speaker before this one, and good morning. Sorry to join you late, and I may have missed some of what was said, but for those who don't know, I chair health for the Congressional Black Caucus, work with my Tri-Caucus colleagues on health, which is the Hispanic and the Asian Pacific Island Caucus. And I think, this initiative of Senator Clinton's really just shows the kinds of insight that she brings to her job as a senator and that she will bring as president, and the kind of really nuts and bolts approach comprehensive approach that she provides to many issues, including breast cancer. Of course, as an African-American woman and as a physician who has seen many patients come into my office when it's far too late to be helped, I have a great concern about this particular disease, breast cancer, and in particular in minority women. And as is always the case, Senator Clinton goes the step further. One, beyond research, because too many times in Congress we have all of the bells and whistles around research and not enough around the less exciting stuff about providing services. Her proposal provides research and provides services. In addition to that, she makes sure in this proposal that she addresses those who can't afford it to have their mammograms or their pap smears and who can't afford to have the treatment. And she particularly goes the other step further to include research on African American and Latino American women, women of color, because many times we're not included in the studies, and so the treatments that come out of that research may not reach us as they might need to. So not only in research, but also in ensuring that as because we are so prominent in the low-income populations in our country, that we will be able to receive the same not only research but services. So this is really a great plan, and as the previous speaker said, no one is addressing this particular topic, which is so important to women, as Senator Clinton is.
Thank you, everyone. We'd now like to open it up for questions.
Yes. Participants, if you have a question, please press star 1 on your telephone keypad. This will place your question in the order it was received. Once again, if you have a question, please press star 1 now. And we'll begin with our first question.
Hi, folks. This is Daniel Nassau with the Guardian newspaper. The question's not about breast cancer. I guess this is for Ms. Brown. Are we going to see any strategic shift in the campaign with the departure of Mark Penn, do you think? And, who's going to be the most influential strategic voice in the campaign? What do you think?
This is Kathleen. I just want to remind everybody this is a policy call, and we would be happy to talk to you about those questions if you would go ahead and contact our press office, and we'd be happy to talk to you about that. But this is really a policy briefing, so we do need to stick to the subject matter.
Well, thanks anyway.
Okay.
We'll take our next question.
Hi, guys. This is Lorraine Willard at Bloomberg News. When we say we're going to increase funding, we're going to increase funding by $300 million a year, and so what would that bring the total to? So, like, how big an increase is that, relatively speaking?
The funding level right now for breast cancer research is around $750 million a year.
So who's this talking?
This is Catherine Brown.
Okay. So we would, so it'd be $300 million on top of the current $750 million in federal funding.
Exactly, and the ultimate goal is to double it to $1.5 billion over 10 years.
Okay. And just one more follow-up. What has happened to the spending, the $750 million that's the current spending? How does that compare to spending, 8 years ago when Bush took office? Has he, has there been evidence of him cutting this funding, or has it just been steady?
Well, as I think Fran said earlier, what we've seen with NIH is really flat funding, minimal increases that when you take into consideration the additional costs of advances and technology, it's resulted in, really more of a cut. And so I can get you the precise numbers on adding up those going back to 2000, but it's definitely fair to say NIH has not been a funding priority for the Bush administration.
Right. Okay, if I could get those hard numbers, that'd be great. Thank you.
No problem.
We'll take our next question.
Rodney Livingston at the SPNN.NET television network here in Washington, D.C. It's Rodney Livingston. For the representative, and then if the other fine speakers would like to comment, that would be also nice, too. Are the cancers attributable in this country to the fact that the foods that are consumed in this country are rotten, and then they're camouflaged with ingredients to hide those aspects? Is that a major environmental concern that might be addressed? And then the follow-up to that would be, are desktop and notebook computer mammogram devices that you just plug in. Everyone in the 50s and in the 60s and in the 70s did self-exams, but now is it possible to do self-exam mammograms by plugging the device into your computer and doing your exam right where you are without the need for that expense that one of the speakers talked about? And then if the representative could specifically address this digital converter, there are coupons and vouchers for that, but it seems not to be coupons and vouchers to get mammograms, and I'd just like to hear her thoughts about that.
Okay, that's 3 questions. On the first question on the foods and additives and any environmental causes, one of the aspects of this proposal is that there would be more environmental research because not enough is known about whether it's food or exposure to chemicals. There's not enough known about that. So there's a great deal of research that needs to be done, and this proposal specifically addresses that. I can't see how you could get a mammogram by plugging into your computer because it really requires positioning the breast in such a way that and specifically for some, all of us who have had to go through it, we've had to have our mammograms repeated maybe a second time because the breasts were just not quite placed in the way that they should be. And the technicians that do mammograms, as well as the machines, have to go through regular certification processes to make sure that they are doing them correctly and that the machine is working correctly. So, and it's a very rigorous process. So, on the second question, I don't think that that's possible at this point. And the third question was
with regards to
the coupons. Well, again, the plan is broadly says that the mammograms would be made accessible to low-income women, that the deductible for Medicare would be removed. And so whether it's by coupon or by some other means, the plan includes making them accessible.
But just tell me what your thoughts are with regards to the digital conversion that's going to happen in February of 2009 and the impetus and commercials and television notice of that, but yet it seems to be lacking in that same response in the area that you're specifically interested in, cancers in general.
Well, as a person who advocates for health care, I find that sometimes the attention paid to health care in general is not what it ought to be. I can remember in many instances trying to get funding for health care has always been an uphill battle. Despite the fact that it's something that's so important to everyone. So I'm not surprised, but part of this plan again addresses information sharing, making sure that the information is up. My first patient was in Washington. My first patient was with breast cancer was in Washington D.C. And at the time that she came, one of her breasts was totally infiltrated with the cancer, and it had already gone to the other one. The kind of information, whether it is by TV, by radio, by newspaper, by community organizations, needs to be out there. I agree with you. And this plan has provisions to ensure that information is more widely disseminated.
Thank you.
We'll take our next question.
Hi, this is for Catherine. This is Leanne Caldwell with Pacifica Radio. I have a policy question. It's not related to this, but it is a policy question. I'm hoping you might be able to answer it. And it is on trade. On the campaign trail in Pennsylvania, with the latest with Mark Penn, how is Senator Clinton going to talk about trade and talk about her position as a kind of candidate opposed to many of the free trade deals that are out there now?
That is
I'm not the best person, but
Sorry, Catherine. We'll get back to you or contact our press office and someone can talk to you one-on-one. It's 703-875-1271. We'll be happy to talk to you about that.
Okay, thank you.
Thank you.
We'll take the next question.
Okay. This will be our last question.
All right.
Hi, this is Kristen Dahm from Newsday. I was wondering, with the $300 million, where is that money coming from, and is that going to draw funding away from other causes, other cancer research?
I'm sorry. Could you say that one more time?
Where is the $300 million for Senator Clinton's plan coming from, and is that going to draw funding away from other causes?
Her breast cancer plan will be achieved and financed as part of her broader commitment to doubling the NIH budget and basic research at major federal agencies. And as she said when she outlined her innovation plan several months ago, she's funding her commitments without increasing the deficit and without drawing money away from research on other cancers by using a portion of the savings from ending the deferral provision in our tax code, which rewards companies for shifting production and jobs overseas. So that's a long way of saying, she's going to take money from a source entirely different, which is to take money away from companies that are shifting jobs overseas and rededicate that funding towards cancer research.
Okay, thank you.
No problem.
I just wanted to say as we finish that many of the treatment issues that Hillary Clinton is focusing on in her plan that are important would in fact be taken care of if we had insurance that covered all Americans, and her Healthy Choice plan would in fact take care of all of these issues that we've been talking about in terms of access to mammograms and access to treatment. And we're all for doing it for breast cancer, but we recognize, at least from the point of view of the Pennsylvania Breast Cancer Coalition, that in fact taking care of the overall issue of people without health insurance would be a better way to go.
Okay, thank you everyone for joining this morning's call. We appreciate your time.